Hello, everyone. Welcome to Movement Matters with three clinicians and a mic, coming to you with three perspectives of physical therapy. Hi, I'm Jessie.
I'm Christiane, the PTA.
And I'm Veronica, the PTA.
And today we're going to be talking to you guys a little bit about myths that occur around physical therapy. The first one, we have 10 for you, and the first one is that everyone thinks that physical therapy is just exercise.
Oh boy. Oh boy.
Well, I guess I'll start talking about that a little bit. I used to think that. When I thought of physical therapy, and again, I tell my students, and I say it because I relate to them. You think, oh, just like athletics and sports, and you're just gonna have them do some walking and some exercise and easy peasy.
Right.
And then I was so surprised, but in a good way, to find out how much more it really is and can be.
Yeah, the one thing that I will say is, yes, that is a big deal. A lot of people that come to check out our program, since we're professors in a physical therapy program, we make sure that they actually hear that from our mouths, right? Like, yeah. Listen, why did you choose physical therapy? And their response, which is a common response, is often, I like to exercise. I'm an active person. And we're like, okay, cool, good. But there's more to it than just exercise.
So what is there? There's modalities, right? There's manual therapy. There's different categories of like niches, right? We have neuro and cardio, and of course MS. There's a lot of exercise in that one.
Right, there's a lot of exercises, of course. You have to
I'm sorry.
No, go for it.
No, I was saying, going back to like pediatrics, which we love, right? How do you exercise a baby? I mean, we know it is kind of exercise, but obviously you're not giving the baby 10 reps of bicep curls, right? So, but we treat children. Why? Because we're doing training on how to get them to do the everyday things like rolling and sitting and crawling.
Reflex
integration. And it's a form of exercise in a way, but it's not, I think, what most people consider exercise in terms of like grabbing
going
weight
to the
or
gym
running
or treadmill. Another thing that is a pet peeve of mine, and I don't know if it fits, but it just popped into my head is, oh, you're a physical therapist. Can I get a massage?
Oh yeah. We hate
my gosh. Not try to diss our massage therapist, but there is a whole profession that does just that. No, you're not coming to us to do exercises and get a massage at the end. No happy ending. That's not how it works. Okay, that's not how it works. So there's a pet peeve of ours there too. Do we put our hands, like you said, manual therapy, soft tissue mobilization? Yes. As a matter of fact, I'll put that in there. When somebody says that to me, I'm like, sure, massage, and I'll go with that elbow.
Trigger point.
Let me show you what a massage that's gonna hurt. Okay. So at the end of the day, there's so much more, and we can go and break it down, but what are some other myths about it?
All right. Myth number 2 is that you need a doctor to refer you to go to PT, and that's not true.
That actually has changed in recent years. This thing called direct access, which we do have in Florida, which is where we're from, where you can just go see a physical therapist for private pay. And you don't have to necessarily go to the doctor and get a referral. Now, of course, a lot of our patients are going through the insurance, so in that case, they may need a doctor. Right. But if you ever just wanted to check out something that could benefit you for your alignment, like we were talking about knee pain and core strength and all that stuff that we've been talking about, and you were like, I think seeing a physical therapist could be a good fit, a good deal. Just like you go see your chiropractors or whatever, you can do the same thing.
Right. One thing that's cool about direct access, and I like to give my perspective because since I graduated so many years ago, there was none of that. So yes, when I graduated back in 2001, all the orders that came for physical therapy required a referral from a physician, right, and things like that. Whereas I want to say about 2009, maybe 2010, it changed to direct access, or at least with the DPT. So now they're doctoring physical therapy, like Doc over here, and that allows the direct access. I will say that for the most part, the facilities that do direct access, they'll try to limit for 30 days. In other words, you won't need to go see a doctor or someone else to refer you to the physical therapist, but it so happens you need to stay with them for longer than 30 days. Then they may choose, right, Doc? And you can give us your 2 cents on that. They may choose to say, okay, I've treated you for 30 days. it didn't work. Now go get a physician to try and, so that's one of the things, right?
Right. Yeah. So we don't really need to send you back to the doctor if in the time period. And again, here in Florida happens to be 30 days, but maybe the
Other
state
states, right.
other states would have different times. If you get better and you recover fully and everything's going well, then there's no need to go back to the doctor. And you may say, well, I don't really have a lot of cash these days and paying out of pocket sounds a lot. However, if you think about if you go to the doctor and then you have a co-payment there plus whatever they do at the office, and then maybe they send you to imaging, and then imaging is going to cost money too. Yeah. So if you add all those things and all the steps, maybe it actually ends up being cost effective to go first to the PT. So that's something that everyone has to kind of see on their own. And it's dependent on the insurance, but I'm saying there is potential to actually save a little bit.
Which let's add that in there. And whether we want to throw, stir the pot a little bit is, do imaging really, is it really the answer? In other words, you have a back pain, and the physical therapist is able to do special tests to try and determine whether it's a herniated disc, whether it's a muscle entrapment, or if they have that ability, those skills, they're licensed for it, then getting an image, an MRI, may not necessarily be something that it validates it. Right. Like, in other words, so a lot of people I see out there, no, I must get an MRI. So what? What is the MRI besides you already know you have a meniscus tear? So you're going to get an MRI, tell you have a meniscus tear.
Right.
Okay.
Yeah, exactly.
Cool.
Or sometimes you just, again, I'm sure we're going to say or have already said, I don't even know at this point, that it's about the actual issue, whether it's posture, whether it's weaknesses. Right. And so sometimes you see, okay, I have a little bulge that's sticking out. I have this, and that's true. But that's not really what's causing
That might not be the main reason. A lot of people say, well, I think I have a herniated disc. Now my back hurts. And then they get an MRI and they have a herniated disc. They can't tell whether that herniated disc just happened or happened 20 years ago. A lot of people walk around with herniated disc without any issues because they have good core strength and they have good mobility, good posture. Exactly. So there's a lot of myths there. Like you must prepare to get that professional help. Not necessarily, especially if you're in Florida. You look for somebody you trust. A lot of health savings accounts will pay for stuff like that. Like there's a lot,
Yeah. All right. Ready for myth number 3.
Okay.
PT is only for injuries or post-surgery.
Ooh. I love that one because I always talk about prevention.
Mm-hmm. Right.
Yes. And I think that's the biggest place that we should be going if we're not going as a field. And we always try to make sure that everybody focuses on that patient education to really target prevention as well for future things if they are coming with an injury. But even if we see somebody in the street and we're like, hey, be careful with what you're doing there.
Right.
So that's how it helps.
Is really huge.
Yeah. And not just in adults, in children, in pediatric patients. There's a lot of times there's the early intervention programs that exist that may be dependent on states. However, those help prevent further delays or injuries in our young population.
What about that older population that never really had an injury, but just by getting older, being more sedentary, now they walk slower, they don't have as much of an efficient ambulation propulsion forward, so they're getting really tired, they're running out of stamina. They haven't been injured.
Right.
Okay, but they still need us. Right. So, there is definitely a lot. Wound care. Somebody who's been, sitting for too long in a wheelchair and now they have a big wound that doesn't heal. They weren't necessarily injured. That was something that happened over the time, unless you could say an injury from the wheelchair, but they didn't fall or it wasn't anything like that. We still have to see them. We still have to stretch them. We still have to change positions, take care of the wound. So definitely there's a lot there that people are not aware. I think also the most important is for the pediatrics, because I think that people don't realize they either go to the doctor or not. So there's no midway. Oh, my kid didn't get hurt. They're just walking.
Or maybe they were pretty healthy during the year, so they're not going to the pediatrician only the one time a year for their annual checkup. So then the development doesn't stop or start and stop only at the birthday mark. It happens throughout. So
another one that I need to say, and we said this in one of our podcasts, but the pelvic floor, we talked about this. Pelvic floor is not injury. is over
Right.
time, it's gain weight or pregnancy or whatever, pelvic floor weakness, okay? People peeing their pants for no reason. Those are things that are also addressed by physical therapy. So no, it is not just for people who had surgery, not just for people who broke something.
Right.
Okay.
All right. We're ready for
Yeah, we're
myth
trying to be
number
good with
4.
the time now.
Yes. So you guys have heard no pain, no gain. That is the myth number 4. What are we called? Personal torture, or what is it? PT.
Yeah,
PT is
stands for pain
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 and
and
torture.
There you go. Yeah.
Okay.
No.
I do have a little saying that I've like accommodated
Modded.
from this,
Okay.
and it says no pain, no gain, but joy and pain is in vain. In other words, so let's first of all break it down. What's pain? What kind of pain are we feeling here? Right? No pain, no gain. Okay, well, all right. Are we working out? Are we feeling pain?
Muscle
but it's
soreness.
like muscle soreness, you're tired. Okay, cool, then no pain, no gain. But are you working out and every time you lift something, there's a pinch?
And it
There's
takes you 3 days to recover?
To that one,
Yeah.
that's no bueno.
Yeah.
Well, again, going back to what you were saying about the massage, they think, oh, well, I'm going to come for a massage and a hot pack because that feels good. Which we do that because we pain manage too.
Right.
So again, we're not trying to hurt you all the time.
Right.
On the contrary, if you have a lot of pain, we want you to not feel as much so we can get more done.
Correct.
So not to say that some of the things that we do aren't going to cause pain, but we'll try to help you also relieve that pain a little bit.
Absolutely.
Yeah, then that's a good point. It depends on what they're doing. Like for me, I'm an ortho person. Like, so a lot of my life and as a therapist, I work with people with orthopedic injuries, knee, shoulder, back, all of that. Some things you're going to have some discomfort. You're going to have some pain. Some things you're not. And as a matter of fact, I use the range within the pain. In other words, before you reach the pain. So let's use an example if somebody's doing something overhead. Okay. And if they're coming to about here and they don't have pain, but past that they have pain, guess what I'm going to do? I'm going to go up to the level they don't have pain.
Right.
And then that actually grows. There's a lot more.
You don't want to look for the pain, like, oh, I got to push through this,
Right, exactly.
All the mechanics and
that's what we're trying to say. No pain, no gain is too much of a blanket state. It's too broad.
Right.
No pain to what? How? What kind of pain? Lingering pain?
Right.
Achy
pain is different than sharp pain, right? And dull pain, and nerve pain,
red flag pain,
right? It's accompanied with swelling and redness, and you're having all those things, and we don't want that. So,
is it a pain that started in the middle of your back and now it's radiating down your leg? That's no good.
Right.
Is it a pain that started radiating down your leg and now it's actually retreating back to the center of your back? That's better. So, I mean, we could spend the rest of the minutes that we have here talking about that, but I think that that's the important myth in that sense is don't push through certain pains. Be aware of how that goes.
Okay. Myth number 5 is going to be that PTs are the same as personal trainers.
Well, that obviously doesn't make sense. Why would there be both?
Yeah, very good point.
I mean, why would
very
you
good point.
That?
I'm gonna say that society confusion is validated with the fact that we abbreviate our names the same.
True.
Sorry, PT, certified personal training, CPT.
Yeah.
Doctor in physical therapy, DPT. So if you're someone who's never
pharmacy tech, PT.
PT.
I mean, PT could be a lot of things.
We are PTAs, parent teacher association.
All right. PTA, parent teacher. Like it could be anything. No, but also when we're in the wellness space as well, right? Or we could be with the prevention and the exercise. And of course there's some similarities, but again, the training is very different. You can look that up. You can do research. You can see that personal trainers don't have any licensure or laws or anything governing them.
Right.
And the certifications that are out there are just that, tests and programs that are sold which gives good information, but it's not a board thing or stuff like that.
It's not regulated.
We do have to do.
Right.
Even as PTAs, we have to take a board and pass that to get licensed, and then our DPTs as well.
Right.
Which kind of goes to why I created my our program, which is physio training, because it's one of those things that, and it can be a whole other episode on that. But the truth is that yes, unfortunately, there are amazing personal trainers out there. But it's only fortunate if they want to learn more and go further. But the actual program of personal training, at least in America, it is very unregulated. It's very free. And unfortunately, that puts out a lot of unqualified personal trainers. Whereas with physical therapy and physical therapist assistants, you must pass a licensure that is given by the state, the commission, and that puts the level of standards a lot higher. So no, if you graduate as a PT or PTA, you will automatically, in the eyes of the law, have more authority over any certified personal training in the country, even if they've been a personal trainer for 30 years and you only licensed for a year. It is what it is.
Now, I don't know what's in the personal training exam or whatever, but I'm just assuming, maybe my personal trainers out there can correct me if I'm wrong. I'm assuming there's not a lot of stuff about different pathologies and how they manifest and how they progress and like how to assess things.
We're trained in the clinical reasoning and checking and make sure that the patient's safe to progress or sometimes even regress is what's needed. We're able to adapt to the patient based on their signs or symptoms, their presentation, all the emergencies we're trained in as well, right? So
with that said, I want to put a shout out to the personal trainers who have thought about stepping up the next level. Go to physical therapy or physical therapist assistant school. So that's cool. That gets you in there already. So,
I got an advantage.
I'm excited about myth number 6 because this is going to be important for our podcast. So, myth number 6 is that rest alone will fix the problem.
No,
because movement matters. Yes. So obviously we don't believe that rest alone is going to fix the problem. Is rest super important? Absolutely. We need to rest joints and areas that have been recently injured. We always have to assess, and sometimes rest is required. Doesn't mean that alone it's going to fix the problems, because a lot of the times we actually want you to move the joints above or below during that process, and then we want there's actually new research that shows that the earlier we're moving, the more we recover. So I don't know,
the benefits of early mobility are huge, from you maintaining the lubrication of that joint to the soft tissues around. You don't want to think about it. Every time you hurt, you don't want to move it. You want to rest it. So that's what we call positions of comfort. That starts to shorten everything, atrophy everything. In other words, now the muscles that you're not using are going to be even weaker than they were possibly going to be. I think the main problem, guys, and this is where audience and people should go seek for someone that knows a little bit more, is when should you not move? Like that kind of stuff. Like what kind of movement? Because yes, you said joints above, joints below. So as an example, if I hurt my elbow, I want to be pumping my wrist. I want to be moving my shoulder. I may not necessarily want to move my elbow right away. And that's why you said, I like how you said it. You said rest alone will not fix the problem. And so there could be a problem when people don't understand when is it too early to move, when is it too late.
Well, that's why they need to come see a physical
therapist. That's one of the things that we push for you to be like, hey, listen, yes, you should rest something, but you should move it. One thing I do want to say before we go to myth number 7 is this. Back pain is the main one that you do not rest. Okay? You do not do bad rest. You can look that up against my information. Bad rest is the worst thing you can do for a back pain. Now, that is almost counterintuitive. Because if somebody hurts their back, what they want to do?
Lay down.
But if you lay down, it gets that much worse. So, I mean, we're not going to elaborate on that, but look it up.
All right. Myth number 7. Surgery is the only real fix.
No, not at all. Maybe this is a good time for those of you who don't know. know to bring up prehab, right?
Right.
So you heard of rehab, but there's prehab. And that's all about trying to do a whole bunch of stuff before you go to surgery or to try to prevent surgery.
Right.
So that's a big part of
yeah,
it.
I just want to put that on there. One of the things I do want to say about surgery is this. Sometimes it's the only way. I agree. But unfortunately, and again, I can only talk about America. America's health system is not set up. It's set up almost like a business. It's a corporation. Okay, so what that means is many people who end up in surgery maybe wouldn't have needed it had they gone to physical therapy.
Right.
That's what we're trying
The
to
last
say.
resort.
So
It is for me a last resort.
I'm going to give you a case example. And again, this is not for everybody out here. Disclaimer, this is a one example of one person in my life who had a rotator cuff. All of them were torn, and he's my grandfather. May he rest in peace. But when he had the injury, he's old school, like did not want surgery. He was one of these people that never went to the doctor. So he was obviously not going to have surgery.
Right.
So he's like, what can I do? So I gave him a whole rotator cuff protocol. He had a barn at the time, and he made a makeshift pulley system and
That's
was
amazing.
doing pulleys like every day. I don't even know how many sets and reps, was doing the wall ladder. And he had full range of motion without a rotator cuff, completely torn, no frozen shoulder, no secondary issues. And he was like using his shoulders and his arms till the day he died. Again, is that for everybody? I'm not here to say that is, because if you're in sports and you're a pitcher, you're going to probably need that a lot faster than as long as it took him to recover. However, is it possible to have muscles that get stronger and therefore kind of take the role of others? Yeah, our body does that.
Absolutely. My
And
husband
so-
has 9 herniated discs.
Wow.
Yeah,
That's a
he's
lot.
a jiu-jitsu fighter. He's
Yeah.
been, he's worked carrying heavy things. If you read his MRI and you're like, oh, this guy's on a wheelchair.
Yeah.
Right.
And then you look at him and he trains jiu-jitsu every day.
Right. Again,
Okay.
it's
So
very
he's
case by
he's
case,
actually
yeah.
contemplated that. He's like, hey, should I go to surgery? I'm like,
Are you functioning?
right?
Yeah.
Are you not like? Are you walking? Are you getting up? Then don't. So definitely this is a conversation between you and your physician and your
I
therapist.
may say something like you
Individualized.
say, it may stir the pot. I really do think it's based on two things. Is it how much time do you want to put into it? How much time do you have? Like the urgency of rehab, which is another myth later. I don't want to get to that myth yet, but if you're willing to put in the time to rehab
Right.
and you're able to be a little patient with it, then to be honest, you may not need surgery. So,
Very true.
okay.
Very true.
Myth number 8 is once I feel better, I can stop PT. Ooh. Everyone
That's a big one in lots of ways. Number one, because we give you these things called home exercise program to continue doing everything lifelong, because movement matters forever.
Yes.
So if you're only doing certain things that we tell you when you're with us, then obviously that's not going to carry out long term, right? And number two, again, going back to pain and stuff, which is why a lot of people come see us. The issue again is not the pain. The issue is whatever you did to get the pain,
Right.
faulty mechanics, whatever. So if you feel better, if you stop coming because you feel better because your pain went away, then you didn't fix the issue still.
So for me, I like that. My analogy with that is a diet, right? When somebody says to me, I'm on a diet, I feel that that's the wrong approach. Now, you might want to lose weight, you might want to gain weight, but you should think about changing your lifestyle. Because when you're in a diet, you're literally putting a time frame on your head. And what that means, let's say for losing weight, or I'm on a diet for 2 months. Okay, well, what happens is when you're done with that diet, you're like, woohoo, and you go back to your old lifestyle.
Right.
Then you look like an accordion, up and down, up and down. Okay, that's the same thing. When we give you an exercise prescription, it literally is a prescription. The difference between that and you taking a heart medication for the rest of your life is that you're not swallowing my prescription. You're doing my prescription. But it's the same process. You have a heart disease. Okay, you're going to have it for the rest of your life. Are you going to, just because you feel good with the medication, you're going to stop the medication? No, you're going to continue taking it. You have arthritis. We saw you for whatever amount of weeks. You felt better. Guess what? You're going to keep doing it. So I think that those are the
And
things.
you're gonna keep having
There's so,
arthritis.
yeah.
That's
So
how
you
it's
gotta
gonna be.
keep doing it.
There's so much about this that I could talk about because I've seen it in pediatrics. Like, I'm going to take torticollis as an example, where they come with maybe too
The little
weaker,
neck.
with the neck is side bended and rotated, and then I give them a home program and they stretch it, and then they come back and then it's better, and then they come back and it's better, and then they're like, okay, 2 months into it, oh, they don't need therapy anymore, but they don't realize that the brain learned this position. And so in every developmental movement, it's going to go back to that. So I need to see the kid till they walk, right? So I can make sure that they hit all their milestones, yet they look a little bit better.
Right.
And then they want to take them out of therapy. And I've had parents that have actually come back. They're like, oh my God, they're regressing. I'm like, well, no, you didn't let me finish the whole program, because that's the position he knows. We got to make sure that their head's straight throughout.
Yeah.
Same thing with adults. Like, you feel better and you don't have pain. That's because you passed the acute stage.
Right.
Now you're in a subacute stage. That's a whole protocol of rehab. And then there's actually the chronic stage, which is where we're really going to get into all the functional things and all the fun. I call that the fun stage because you get to do all the creative things.
Chanel.
The fun.
Oh my God.
Yeah. Yeah. So again, like you got it. I think we live in a society where we're so used to everything now.
Yeah, I blame social media for that.
Well, Uber Eats. Love
everything. Everything
like
is,
we order. It's a click of a button and it's at our door. Amazon, all the things, and so they want therapy that way. And the body, everybody's body is different, and it takes.
And to add to what you said before we go to the next one is the problem too, and a lot of people I think will relate to that, is insurances. If you are using insurance to go to physical therapy, you will be discharged based on your limit of visits before it gets to that level that we really need to be with them. So in Utopia, we would have them for a good amount of time, including the chronic phase of rehab for the functional stuff. Yeah. But it turns out that oftentimes we must discharge you due to lack of coverage by the insurance.
I'm going to do a plug. So reach out to our physio trainer and find out what we could do if you do get discharged.
That's it. Exactly. So the actual, once they finish, it's almost as important that they continue.
Correct.
Than never having done it.
And going back to direct access, I mean, if you go to the PT or just 2 times like that, you pay out of pocket 2 times to get a good plan and some recommendations.
And execute the plan.
That could be why go.
Yeah, absolutely.
Yeah. All right. Myth number 9. I think everyone's going to know that this is not true because we've covered it already. So it'll go quick. Is PT is only for the older adults. We all know that's not true. It's through the lifespan. We could treat all ages.
Yeah, and literally from birth to past 100.
Yeah, like until they want to, right?
Right. Look, I don't know. We're dealing with that 102, right?
I mean, we've had patients.
We've had patients past 100.
Yeah.
Again, you can work with athletes and people who do get injured, which we said we do that. Though not only that, I mean, even somebody in a coma.
Yeah.
Like we move them because, like you're saying, movement matters, and we don't do rest. Even people in a coma, we don't leave them alone and to do rest.
We're still showing the brain how the movement goes, even if they're not aware.
Yeah. So PT is for everybody, and you all already learned because we debunked that it's not only if you're injured. So
okay, exactly.
Alrighty, number 10, last one. All right, it is that results should be immediate. Oh no!
I remember the meme I saw, the guy that drank the Dos Equis beer, and it says, "I don't always go to PT, but when I do, I expect to get better on the first visit." And I thought that was a great meme. Like, no.
I mean, does anything work like that?
No, hell no. TikTok. Look one time, that's it.
But like anything. Like you said, a diet doesn't work immediately. Medicine doesn't work immediately, or if it relieves you a little bit, you still gotta continue taking it. So 100%. Nothing works immediately. So
you took 9 months to be born, maybe 7
not even a baby.
You should be able to win.
So there's this thing called neuroplasticity, which I would love to do a whole podcast on
that'd be itself.
Great. But neuroplasticity basically is when the brain actually changes, and that's what we all want, right? When we injure ourselves, we want what's called motor memory. We want to go back as close to as back as we could
To what it was
before the
before.
injury or whatever the case may be. And so in order to get that, you need a lot of repetition. There's no way, no research, no textbook that's going to say neuroplasticity occurs with one rep. That just does not exist, okay? It takes a long time. Think about those of you that are parents or have seen a kid learn how to walk. Doesn't happen overnight, to be honest with you. Those muscles have been working and recruiting since they started crawling, since they started pulling to stand, since they started holding onto furniture, and that, it's a whole process before we do a skill. And so same thing with our adults. Like anytime we want to learn a new thing, like for example, if I took up jujitsu now, right? I went to your class and I took it. I'm going to start from zero.
One day?
No, I'm not. I want a black belt and I get that black belt.
In one day?
As a matter of fact, I'm going to say something that's very interesting. The school, our dojo, if you go in there and says, I can only be here once a week, they will actually not sign you up.
Oh.
They'll say, not enough. We love the business, but it's not just about the business. You coming here once a week will not show you the progress, and you're going to eventually come back to us and say that it didn't work.
Right.
So that is something that's actually pretty integral that they do there, because they're like, if you can't commit to at least twice a week to come here, then don't do it.
Yeah. Exactly. So the same thing goes with physical therapy. Anything in life that we have learned or a skill that we have acquired, it has taken quite a few repetitions or practice or some form of studying it. Yeah. Same thing for physical therapy and for us to be able to recover. So
that practice makes perfect. It's definitely something
that's a good one.
Yeah, that's the truth.
That is
not a myth.
Yeah, that is the truth. That was very good. Yeah. All right, ladies. So those are our top 10 myths and one truth. But we'll see you guys next time. And don't forget, movement